Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang in New South Wales, as you all know, and it is just gone 20 past 11 Wednesday morning. It gives me great pleasure to welcome Stephen Feit, Dr. Stephen Feit, who is in Boca Raton in Florida, where it's just gone 20 past 7 on Tuesday evening. He has had his dinner, so he's full of beans and ready to go. And there's a lot to talk about. So, Stephen, welcome to the Ultimate Dental Podcast. Great to have you.
Great to be here, David. I've listened to you for a long time, and it's a real treat for me to be along the ride with you.
Well, I'm surprised looking at your CV and mine that it took us so long to actually get to meet face to face virtually over the internet, because we have had similar pathways in terms of our love of customer service and growing dental practices. But sometimes we can work in parallel universes, and it is always nice to meet somebody. And as we have spoken prior to today, you, as you said, you have been following me for a long time, kind of lurking on my stuff. But
Yes.
what we, I guess, have in common is that we both were big fans of Paddy Lund, an Australian dentist who built, the customer-centered dental practice, and you put a lot of that into action in your dental practices and into your career. Before we start opening up the microphone, you are listed on LinkedIn as an expert witness. You're a prosthodontist. You're also a consultant and a speaker. But I like the story that, in 2006, you actually registered a patent for a torque wrench for implants. And there's quite a story to that. So let's talk about that because we were discussing that before we hit the record button, while it's fresh in our mind, because that's a real story in itself. Talk about how you became the patent owner for a torque wrench for implants.
Okay, well, when I was in dental school at New Jersey Dental School in Newark, New Jersey, I became friendly with a professor in biochemistry who invited me onto his research team. And he had a big sign in his lab, and he was doing oncogene therapy. So the concept was that we had a cancer cell that was undifferentiated. It had no function. And it was very much like analogous to an airplane without a pilot. And what we were trying to do is, instead of using chemotherapeutic agents to destroy the airplane without the pilot, we were trying to preserve the cell or the plane, and we were trying to parachute in a new pilot to take back control of that. And he had a big sign in the lab that said, by Einstein, a quote that said, "Do not think out of the box. There is no box." So from an early age, I was kind of like pushed to think of the ridiculous, like what has never been tried before, because it just might work. And every possibility is a possibility. Edison said, when they said, "How did it make you feel that you failed 1,260 times trying to discover the light bulb?" And he said, "I didn't fail once. I just found 1,260 times that it wouldn't work," right? And then you just keep going. So I was under a 1969 Corvette. I've restored many American muscle cars. I like the 50s, 60s, and 70s. And I was mating a M22 rock crusher transmission to the brand new motor that me and a friend of mine had put together. And the motor was in the vehicle, and the vehicle was on blocks. I'm underneath it, and I'm holding the transmission on my chest, which is about 150, 180 pounds. And my friend is helping me bolt it to the back of the engine block. And he introduced an instrument to do so, and it's called a sidewinder wrench in auto mechanics. And after we bolted the whole thing together, I took the wrench and I started to try to take it apart. And I didn't realize that it's a costly piece of equipment. So it was his. And he's like, "What are you doing?" And I said, "This is perfect for dentistry, to be able to screw an implant screw on, say, a second molar way in the back of the mouth with safety so you don't drop the screwdriver because it's latched." And so I went down the road to patent it, and that's how that was born. Thinking out of the box, or there is no box, and always looking for opportunity to improve, to be better. The concept, do you have 1 year of practice 35 times, or did you practice 35 years and every day you got better? Like, I wanted to be better in the afternoon than I was in the morning of each day. That's the kind of concepts. And then as we were talking, that actually helped me in my expert witness endeavors, because I was in a large pool of applicants to be an expert witness on a very large case. And I was selected because of that experience. So I didn't monetize the patent yet, because I believe it's been knocked off, and I may go and see if I can get royalties. I don't want to hurt the person who did it. Kudos to them that they took the ball and ran. I just didn't have the funds to produce it at the time. They wanted $500,000 US, and I was just starting out in practice. So that's the story. Yeah.
Well, I guess that's kind of like George Harrison, and those three notes in My Sweet Lord. He doesn't give the credit to the writers of She's So Fine on his record still, but he does pay them a royalty for those three notes, even though in my mind it's a hard stretch. I can't see that. There's so much back noise in the She's So Fine, but certainly I think you are due something for that brainstorm. And I often talk about how do ideas come together. And there's a scene in my wife's favorite movie, Working Girl, with Harrison Ford, Melanie Griffith, and Sigourney Weaver, where Sigourney steals Melanie Griffith's idea, and it's about helping I think a radio star get into a radio station get into newspapers, and so the owner of the radio station says, "How did you get that idea to Melanie Griffith?" She says, "Well, I cut this article out of the paper, and then I thought this. And that's what you did. You just thought this would go with this." And so when Sigourney had to explain where she got it from, she was lost. And that's a very memorable scene. If somebody steals an idea or somebody lies about a process, they quickly become undone because they haven't thought of all the of the connections. And it's a very powerful thing to have a mind like that. I like what you said about wanting to be better in the afternoon than you were in the morning, because I used to tell my staff at my practice all the time that, we've got to be better today for Mrs. Jones than we were last week. And we've just got to keep improving, make her visit better each time, so that she doesn't feel like she's being taken for granted. She's not, she's very, very important every time with a patient. It's got to be their most memorable experience each time for the right reasons, because dentistry is such a grudge buy. And so in customer service, you really have to do something different, because nobody goes to a barbecue or a cocktail party and says, "Hey, look at the margins down here. Like, they're 15 microns. How are yours? Oh, yours are 18. You should come to my dentist." Nobody says that, but they'll tell you how good the dentist made you feel, or the office made you feel. And that then comes back to that experience that we were talking about with Paddy Land. Did you ever meet Paddy Land?
I did, yes. I went to Atlanta where he spoke, and I met with him and Fletcher Patanen, and we spent a couple days together. It was really very, very memorable.
Yeah, I spoke on the same stage. He had retired, but we got him to speak to a mastermind group that we had every year, and he came to an event in Adelaide, and he he certainly was a lateral thinker. It was very nice to hear him talk and then spend time with him, again, outside and at the social events of that 3-day event. Yeah, very honored to have met him and, again, to have read his books and his whole concept of having an unidentified building in a suburban street in Brisbane as a dental practice. And, as he said, sometimes he'd be outside and people would walk past and go, "What do you think reckons in there?" And, all sorts of things. One pair of women go, "I think it's a brothel." Because you just didn't know what it was. It was just a building with a big gate and a big fence, and that whole concept was of being known for how you treat people rather than for what you do or your exposure, showed that people do care about customer service. So, your track record with owning practices has been quite significant, not only as an owner of 2 practices, I think you said you had, but also working as a consultant, helping dentists to grow their practices. Your record, I think you said, was every practice you've worked in has either doubled or between doubled and 8 times, 2x and 8x. Those are phenomenal results, Stephen. What was your secret in telling people how to improve their practices? Were they all that bad?
No, many of them were really, really good, in fact, and they were just friends of mine who indulged me to come along because we were just starting off as in this consulting program. And what I think the key is that if you're inspiring to the people you're trying to lead, and that starts with trust, or you earn trust. There's a big difference. Inspiration comes from love. That's what you have and Patty has, and I think I have, is that passion for dentistry, the passion to relieve pain and suffering, to enhance one's self-image and self-esteem, and that they can go and live their life to their fullest and get the best job and get the best spouse or mate or whatever it is. And so it was really a function of how open-minded that practice was and how well I could inspire them to come along for the ride and trust me that the end is worth it. And of course, change is scary and change is difficult, and it takes 30 days to make a habit, 30 days to break a habit, as they say. Some habits take longer, and, we all went to those continuing education courses where we were, found something that we really wanted to implement on Monday morning, and we explain it. And of course, the schedule is chaotic and there's holdover emergencies. And then the team says, he'll forget about that by Tuesday morning because we don't have time to implement it. But, I stood strong and stood fast, and I would explain the virtues and how it's going to benefit the patient, how it'll benefit us. And, we have a happier day. And what I also found, and I think you did too, is that not only did the Patty Lund style enhance the happiness of the office, I raised my kids. Me and my wife raised our children that are now in their 20s. We have 4, and they're all best friends. And the reason is because we follow that courtesy system to the letter. That if you have a problem with someone, you go in private and you work it out, and then it's taken care of swiftly. And they knew to do that, and they don't come out of the room unless they each are hugging each other. And it really pays the dividends in the fact that it's a legacy for me because they'll take care of each other forever. That's the goal. And really special stuff. So it transcends dentistry. It transcends family. It can go into any business. It's a matter of how deep you want to integrate and implement the systems.
It's really important, and I think you used a very important word there, love. I remember a dentist friend of mine talking about raising children, and his boys were 10 years older than my daughter when she was born, and he just said, David, he said, children spell love Time, and patients spell it exactly the same way as well. The more time you spend with a patient, listening to them, not talking at them, but listening to them and finding out about them and asking them questions about themselves, the more they love you. And once you have that love, which is then a trust, that then transcends. I often talk about one patient. I remember I hadn't even removed the mirror and the probe from her mouth, about a decay spot on a premolar, that the easiest way to fix it, because it was so far down the root face on the lingual, I said, the best thing is we're going to have to get we can't get a drill in there unless I had one of those wrenches. I said, we're going to really have to just remove that filling and do a crown to get down to get that the best seal that we can get on that restoration. And she's going, yeah, fine. Before I even got the mirror out of and the probe out of her mouth. And I thought, that's her trust in me, knowing that I'm doing what's best and what's going to last. Sure, it's going to cost more, but if I put a filling in there and it didn't get the seal because of the access, then I've been negligent to her. I haven't given her the best result, because every patient in the back of their mind, Stephen, you know this, they don't want to have to keep coming back. Fix it right, doc, so I don't have to come back. Least number of visits, so I don't have to come back. And so, again, just having that respect. But if you make those visits memorable and you make them part of a process within your office, so that you're not the focus of every step and stage, like you don't open the door for them and you don't farewell them. You've got to have team members that lift up and run the concierge style as is needed. And that then creates the wow factor that, as we said, when they go to a barbecue, they'll say, you should see what they do at my dentist before I even get in the chair. I hardly even know I've been in the chair. I've been there that long, chatting and enjoying a coffee before I go in and afterwards. And everybody else goes, oh, my dentist doesn't do that. That's the number one response you want for your patients when they tell people about you is, my dentist doesn't do that. And they say, well, you should go to my dentist, because, it's just common sense that it makes life easier. Dentistry is such a tough buy. It's a tough environment to work in. You've probably met a few dentists who don't like being dentists. And that, when I asked you about those numbers, I guess everybody that you helped had been open to improving what was already probably a very good practice. It's very hard to improve a bad practice, but a good practice that wants to get better is a pleasure to get results for, if the dentist has that, I'll do what it takes, because it is, again, a trust with you as a consultant, isn't it? To, all right, if you say that this is going to work, let's do it. And that's the open-mindedness again. But it's hard to find in dentistry, because dentists, by grouping, tend to be very analytical and, C complex people. They're more into the nitty-gritty of how things work rather than what's the end result. So how do you go finding those people, or is it just like finding a four-leaf clover? There's one there somewhere. You've just got to keep, finding the pearl in the oyster.
Yeah, well, I think, like anything, the first step is identifying that there's a problem or an issue, right? And that kind of has to come from within. But the real thing is understanding that that they have a ability to really make a difference and make it a change. And then you have to instill the fact in the dentist, typically, that they need to be the leader with their team to inspire. And I hate the word motivate, because motivate has some negative connotations. It's the opposite of inspire. Motivation is, if you don't pass your driver's test, you don't get to drive. If you don't eat your dinner, you don't get dessert. It's always a negative. If then is a negative. So if you don't do this, I'm going to fire you. Well, you don't want someone to do it because they're fearful of being fired. You want them to do it because they thought it was their idea. You want to make it so that they think it's their idea. Hey, this is a great idea. In other words, they buy in, right? And so the practices that ADAXed, they were not so good. They were good, but not so good in their systems. And so that was an easy jump. And then when you get them to the level like yourself, where you're really tweaking a memorable experience, and you want to look at them. I worked as a bartender in Atlantic City before dental school, after college, in the casinos. It was the Playboy Hotel and Casino, which is no longer around. But what I noticed, I received an MBA from that experience of, say, 4 months before I went to dental school, because I really studied the operation of how they did it. What did it smell like? What did it look like? What did it sound like? What did it feel like? So when I set up my office, I mirrored that in the fact that, how do I want all 5 senses to be tickled when the patient comes in, right? And that's That's part of the aura. What is the color on the wall? What are the decor? Is the wall clean? Are there water spots in the ceiling? All those little things that make a massive difference. What are the ladies wearing? What am I wearing? How do we approach each step in the process? And then I have a research team on clinical dentistry that I further introduced skills and systems where we identified hinge axis. And this is maybe a whole nother podcast where, and just really briefly, the retromolar pad is a landmark. It's always there, never changes, no matter what. Whether with dentition, implants, edentulous, or removable restoration, it doesn't make a difference. If you draw a horizontal line between the retromolar pads and a horizontal line between the lateral pole, medial pole, the condyles, which is hinge axis, those lines are parallel. And by principles in geometry, if they're parallel, they're infinitely related, always related. And so I always would mount my lower dental cast with retromolar pads parallel to the condylar assembly of whatever articulator is available. It doesn't matter. You don't need extra instrumentation. Everything I just explained costs nothing to do. It's just to change. And people say, well, how do you mount the lower model? Or I don't have time to mount models. I send it to the lab. Well, my laboratory follows this protocol. So I don't have to do it. I can send it to the laboratory. But when I place a restoration, my occlusal adjustment is polishing. I'm rarely cutting because I'm on hinge axis. And if I'm on hinge axis, then whatever we do in the laboratory is going to be accurate in the chair. Now think about that. I have a slide when I present that if you spend 5 minutes a visit and you see 6 patients a day and you do 4 days a week and you do say 30 years of practice, it's like $8 million of adjusting occlusion. And what do you think your assistant or care nurse, that we call care nurse, right? They're holding that suction and they're like, oh, here we go again. You know, it's like you're a door hanger and you got to put the door on the hinge and you close the door and it doesn't close. So what do? We got to rehang the door or you got to take out a belt sander, right? And get the door to close. Well, what do? We take out a belt sander because we're not going to remake the restoration so we don't adjust it. And what do you think the bubble is over the patient's head? Hey, isn't that a new crown? Is that really my crown? Did he mix it up with another person? Like, shouldn't it fit, right? So do we want to practice or do we want to perform? Like if I'm going in for open heart surgery, God forbid, I want a guy or a gal who's going to perform, right? Don't practice on me. I'll wait a couple weeks, practice on some other people, right? So when you implement, you drop the profit to the bottom line because it's less visits, less materials, less chair time. I could see more patients in a more relaxed manner and I'm not putting out fires trying to fix. And what does the dentist say? I need a better laboratory. I need a better laboratory. And it's not. It starts with the process. But that, like I said, that's another whole nother discussion. But that's how you can X a practice is you get the patients to love you. The patients say yes. Your team loves you. The team never leaves. You have very stressless days. The team goes home and tells their loved one how great everything is. And the patients are seen for less visits, easier visits, more predictable, longer lasting dentistry. And then I spend most of the day saying, we don't ask everybody, just like you do and Patty Lund, right? We only ask our very favorite people because we believe birds of a feather. And if I give you these 2 business cards, would you do me a huge favor? I need to replace you and I need another patient to grow. So we're here next year when you need us again. And most people are not. I mean, that's a very confrontational type of discussion because, people are afraid. What if the patient says, no, I don't want to refer. Don't give me those cards. Well, I must have done it thousands of times. Not one person ever said no. And if they say yes and take the cards, it's almost like a nonverbal contract. And so that's advertising. That's my advertising. I just shared my Coca-Cola formula.
I've heard, I heard Omar Reed had a version of that, and he was a little bit more blunt with the patient. And as he finished them, he would hold them by both shoulders and say, look, now I need you to replace yourself because if you don't, I'm going to be out of business because I've completed my dentistry on you. And you don't want me to go out of business because you will want me, as Patty said, to be here in case you need me next year. And so it's almost a threat to the patient if you don't, because the patient knows you're a good dentist and they go, well, that makes sense. He's got to replace me because he's finished all the work on me. And yet you're right. When you mention that to general dentists, they say, oh, that's a bit threatening, but there's not a finite amount of time. It doesn't work if somebody says, oh, your garden looks good. Can I have your gardener? Because the gardener will filter through the number of clients they have and get rid of the bad ones because they've got a new garden that is nicer and the person is nicer. But in dentistry, I think you can pull that off because they understand that a good dentist is just a visit for the hygiene and everything's going fine. And that's only determined by the number of chairs he's got for hygiene. And my hygienist, I see a hygienist near my home down here in the country who used to work for me as a dental assistant while she was in hygiene school. And then she took a job with me for a day a week, but she was always a part-time. She wanted to do some public health dentistry and private. But now she works down here 2 days a week. And if you miss your appointment with her, the next time you can see her is the slot that they had saved for you in 6 months' time. It's that, one time I accidentally forgot and they rang me. They said, how far away are you? I said, I can be there in 10 minutes. They said, not good enough. Yeah, it'll have to be. I said, when can I come? They said, 6 months' time. I just got tied up with some gardening work and thought, oh, I missed that whole entry in my diary. But that's the kind of practice that you want, one where if your patients love you so much and trust you, they're there for the treatment that they need. They don't cancel. And then, heaven forbid, somebody does need to reschedule for a family emergency situation. You've got people who are willing to come forward. And there is a sweet spot. But if you've got lots of cancellations, then they don't trust you, they don't believe you, and you're constantly calling people. That's not a good sign. And you mentioned that with the practices that you consult with, it's easy to find, it's really easy to look at the mistakes as a consultant and know that that's not really the problem. The problem is 3 or 4 steps back. And when we fix it back here, then we fix everything downstream as well. And that's really, really important. And some dentists can't see that. They're always, they're always chasing the wrong end when the problem is really in the system. I like what you've been saying. That's really, really powerful. You're still working as a consultant, I see?
I am, yes.
Yeah, because it's fun. It's fun. And I think, when I retired myself clinically because of the arthritis, although it can be tough having 10 clients with 10 lots of problems mentally on yourself, as opposed to one practice with one lot of problems. It is when you get the success stories, it's when they get it, they get it. And I remember my first consultant was a nightmare in my practice, but my second consultant had them for 6.5 years and tripled my practice in that time. And when you're doing big numbers, tripling is hard. Mm-hmm. And when you're doing small numbers, tripling's easy. But tripling was hard. But it was just about making sure that the patient felt valued and respected and by everybody in the office. It's really, really important. Tell me why you specialized as a prosthodontist.
Okay. I was in the middle of dental school and I went to my dentist who was a big influence on me in going to dental school. He was a faculty member at Fairleigh Dickinson Dental School, which closed during the time I was in dental school. He said to me he would really love someone like myself. I know him since I'm 5 years of age. He would love me to come in. He didn't have a son or anybody in his family going into dentistry, and I was the closest thing, and we felt a real kinship. And and so he suggested that I go on for additional training because he was a prosthodontist. And in order for me to cover his emergencies, if that came to be, I would need to have those skills in my toolbox in order to understand what he did and how to fix it. So also he wasn't ready for an associate at the time, so it would buy him a little time while I was in training. So then, of course, I finished my training a couple years later, and he still wasn't ready. But it was the best advice he ever gave me. It was just, it turned out that my clinical advisor happened to be a prosthodontist also. And it just one thing fed the other. And, you migrate to what you do really, really well. Just like you treatment plan to your strengths, you know your own limitations and where you're really strong. And so I really enjoyed the whole process. Orthodontics was just too slow a result for me. I like more, I'm more kinetic. At least I knew myself. And I ended up at the Goldman School of Graduate Dentistry at Boston University, and that could be a great segue to a story that I usually end with. But I really latched on to some outstanding professors. One of them was Bob Stein, who invented or evolved into the modified ridge lap Pontic. And he did all the classic studies on emergence profile. David Baraban, Paul Lustig, these are pillars in the community. Unfortunately, most all of them have passed by now because they were much older, probably in their late 70s when I was a student 35 years ago. But, the old saying, David, you can only see the horizon by standing on the shoulders of the greats who have come before us. But you have to identify who those greats are, and you have to be humble enough to know what shoulder to stand on, and that you are standing on someone's shoulder, and that in turn, I'd like to have big shoulders for others to stand on, and I can push them like a pole vault. Like you and me as consultants, we're actually like a pole vault. I always tell my kids, look for a pole vault. What can help you go from where you are to where you want to go in the easiest, quickest, safest, most predictable, correct manner possible. And so that residency really pushed me way ahead. Many of my friends who didn't go to residency ended up with the same skills. It just took a little longer. That's all. It's no big deal. But that's how that evolves. People would say, you got screwed by the dentist and everything. No, he opened a door for me that I didn't even consider. And the contacts and the connections and everything in life brings you to your next endeavor. It's an amazing, and as an expert witness, I truly am an expert. I sit in deposition, which is a very, very confrontational experience, especially if I'm helping to defend the dentist. The plaintiff's attorney only gets paid if they prevail. So I'm the one who's standing in the way of that payday. And so they get very aggressive, verbally aggressive. And you would think that I committed murder and I'm on trial for murder. I'm like, listen, I'm just answering your questions.
So that's an interesting segue there. That not only are you a dentist, so people hate you because you're a dentist. Now you're an expert witness, and people hate you because you're an expert. So you've doubled the hatred towards you. It must be tough. I despise courtrooms and lawyers, and barristers, and I've been in them and their processes, and the fact that they're all good mates with each other. Really, really, win or lose, they both win financially. Either, that's what happens, and it frustrates me that that's the situation. I once said to a lawyer, you win 50-50. He goes, no, we win all the time. We get paid all the time, so whether we win or lose. And I'm going, that's horrible. But as an expert witness, you've got to be very thick-skinned, because it's like getting out of a trench in World War One. They're firing bullets at you as soon as they see you, and to have that mental fortitude to fight back, and then be respected by the judge who's going, geez, you're a bit arrogant because you know your stuff. That's also against you if you've got an opinion as a witness. How did you end up liking that sort of stuff, Stephen?
I think, well, my dad was a lawyer for a very short time, and he didn't like everything that you explained. So he ended up going in a different direction. But his mind was trained as a lawyer, as, the Socratic method. You ask a question, you get an answer that sets up the next question, and it's like a chess game. So I was raised in that environment. So when I'm in depositions sworn in, which is like court, I'm very, very comfortable because no one can be tougher than my dad. But it was love. It was love. He wasn't tough. He was just, these were lessons that needed to be learned. And he did it in a kind, caring way, but he did it in his way. And also, I'm a very proficient martial artist, and it's a long story as well. And so I'm very confrontationally tolerant. I have used it on the street where things started to go bad. You find yourself in the wrong place at the wrong time for all the wrong reasons. And I was a lot younger then. So that's a story for a different day. But I'm a protector. And so it's okay, when they start slinging the arrows. My dad always said, just because someone tells you to go to hell, Stephen, doesn't mean you got to go. So, but I've been there. I have a locker there, and I know my way out, so I'm comfortable. It's no problem. We've all been there. Some people know it, and some people don't.
It's an interesting place. My brother, is a barrister, and the lawyer then became a barrister, and I just he's a different sort of person, and he thinks in a different way to his sister and me. It's an interesting, and that's a story for another day. Let's go back when you said you were a barman at a casino. I wondered where that was going, and thanks for clarifying that you analysed the business of the casino. I also worked as a barman while I was at dental school, 5 nights a week to to pay my way through or to keep it. Dental school was free back in my day, but you still had to survive. You still had to feed yourself and house yourself. And my friends used to say that I actually only went to dental school for something to do during the daytime. But I learned the service element of being a barman and also a tray steward, that if you gave people great service, they gave you better tips than those who didn't appreciate the service, and he also ended up with a longer line. In a bar, I would have quite a long line of people who would want to, chat with me, and sometimes I'd be a little heavy-handed in the pour, which they liked as well. But it was just about getting to know them, and also getting on trays, getting the drinks out quickly to them as well, and keeping their tables clean, and asking them, "Are you ready for your next drink?" Again, just that service element, and it's the same. I'm always looking in restaurants when I go to a restaurant. How is it? How is the restaurant run? So how does the team work? And especially when you're working with a team, on a degustation where you might have 8 different dishes brought by 8 different wait staff, just depending on, here's this dish, take it to table such and such. So there is a science in that. The other issue that, as you know, with customer service is that when it goes bad and when it has been good, be it with your airline, your hotel, your even your taxi driver, who you can pick them up on these sort of things and sometimes help them. That you used to do this, but now you don't. Was there a reason you've dropped doing that? And sometimes they've forgotten, as in the dental practice, and so the system has failed, or sometimes it's been with airlines, it's just a directive from above that we're cutting costs and these things have to be cut, but the consumer knows these things as well. So in dentistry, we've got to always make sure that once we have a standard, that we never drop that standard. We never go to smaller, thinner bibs. We never go to no frills tissues that sand people's faces instead of make them feel soft. It's just the little things that make the big differences in the customer service.
That's so well said. Yeah, I think I was very shy prior to becoming a barman, and you had no choice. If you want to fill that tip jar, you need to interact. You need to make things right. If there's a problem, you need to learn how to manage complaints, right? And then you want to be anticipatory, right? You see someone's about finished, you start mixing up and you give them another one, and they're like, wow, he's on it. He knows what I'm drinking. He remembers me. I'm important. All those things transfer into friendships, into family, into patients, into clients, no matter what you do. And yes, you're multitasking. The plates are spinning, right? Everything is going. It's crazy. And you can make a lot of connections depending on what bar you're at. I was in a lot of country clubs, and of course, there's very successful, affluent individuals in those clubs. And I did make a lot of connections that I have tapped into. So every opportunity, people would say, you're cleaning up slop behind the bar at 4 a.m. Yeah, but I've made connections at midnight, a.m., a.m., and the cleaning up of the slop is just part and parcel of what we have to do. But I didn't get bothered by that either. I'm no better than anybody else, and why not me? I'll clean it up. Not a big deal.
No, and you're right. And sometimes people forget about that. At the end of the night, when the nightclub empties, you got to put the chairs up so that the cleaners can come in. It's not the cleaner's job to come in and lift all the chairs up. It's the bar staff and the floor staff's job to get that ready so that they can get in and clean underneath. And then the next staff then come in and put the chairs down as well. Again, that's a system as to what has to be done. And sometimes in a dental practice, they say, well, why am I doing that? Why am I doing that now? And you say, so it makes the job easier for the next person and then the next person, because if you don't, it just domino effects down the line, and then we lose our most valuable resource, which is time, because it could have been done here and prevented a time loss. It's interesting. One of the problems that dentistry in Australia is having today, and I don't know if it's a thing in the US, with dentists who work as associates in a practice. They're not the owner of the practice, but they work on a contractor arrangement. Well, I don't know if it's a generational shift, but the contractors seem to think that, well, I can come and go when I please. If I want to take time off next week, then just cancel my patients and move them. And of course, that then goes against the principles of customer service, and especially the principles in dentistry, where people often make an appointment and then plan their whole day around their dental appointment. And then so if the dentist pulls the pin and says, even if the dentist is sick, then it can throw that person's whole day, because they said, well, I was going to do this and this before I got the dentist and after, and now the keystone of my day has been destroyed. So there's a switchback also in terms of the fact that an employed dentist is really not providing anything except labor. And so the tax office in Australia says, well, if that's the case, then they are an employee and not running their own business, because they don't have their own customers, they don't provide their own equipment, and often they don't even provide their own uniform. They have to work under the umbrella of the practice, be it a Ritz-Carlton practice or a McDonald's practice. They still have to follow the systems of the practice. And so that's becoming a difficulty for owners of practices who are saying, well, I've got this good practice, so why would I allow somebody who's got no equity in my practice to come in and just run their own corner of it and upset the processes? Are you getting that sort of thing happening in the US?
Oh, very interesting. When I had my second practice, I bought this little practice and I started to build it up. And I wanted to get an associate because I didn't want to work in the practice myself. And so I took it upon myself to interview as many applicants as I could, because life is a classroom, right? I want to learn what makes these people tick. Why do they want to pursue an associate arrangement instead of purchasing a practice and becoming an owner? So I interviewed over 60 of these individuals, and I said, each one of them, I gave them a blank sheet of paper and a pen. And I said, I want you to write down the top 3 to 5 things that will make you happy here. And the first thing is, I need X dollars a minimum a day. I need X number of days paid vacation, and so on, stuff like that. So I said, okay, you have everything you want. Can you define what a relationship is for me? And they sit there and they don't say anything. So I said, well, let me prod you. A relationship is give and take, right? Give and take. So I just gave you everything you want. And they sit there. I said, what will you offer the practice? What do you have? Well, I'm going to do the dentistry. Okay. So I said, do you want to buy a practice? Maybe someday. Have you read a business book? Never. So they're like entitled. I don't know if that's the proper word, but there's like no. So one of them actually said to me, and I was waiting for this. Well, she turned the paper over and slid it to me, and she said, you write the top 5 things. So I said, I'm going to work harder than you have ever seen anyone work in your whole life. I'm going to come early and leave late. I'm going to go to as many continuing education courses and be the best that I can. I'm going to learn how to explain dentistry so patients say yes. I have an open mind. I'm going to take as much experience from you that I can possibly take. If you're willing to offer me mentorship, I would love that. And I'm not asking for 1 penny. You'll pay me what you think I'm worth, because I'm going to be worth way more than what any minimum I'm going to throw out to you. And the young lady just sat there. She said, you would never do that. I said, I've gotten several positions. I got the bar position at the Playboy Hotel and Casino in the Playmate Lounge. We were making tons of money. My professors in dental school said that they would have never quit that job and gone to dental school, that the money was just so good. It was super good. Yeah. I just didn't want to work till 4 a.m. every night. The money was really, really good. And but anyway, so, Zig Ziglar says, if you help people get what they want, people will help you get what you want. No one ever taught me this. I don't know. I just feel it's maybe it's common courtesy in my world, but I'm just gonna have an unstoppable attitude, and I'm gonna do way more than what you expect. And then you're never gonna fire me. You're never gonna let me go. You're never gonna be upset with me. My reputation will be stellar, and that's what it's all about. That's just me. But to your point, I hired someone and he's never going to buy the practice. I ended up selling the practice, and I became very good friends with the buyer that bought it. And we're looking to do other things together in a business sense. And he still has the associate, and the associate will not buy. He just does not have that. It takes him 2.5 hours to do a crown. What could you do for 2.5 hours? Like, if you drill a hole in the wall, how long can it take to drill the hole in the wall? Like, when you drill the tooth, I can't fathom what they do. Like, how long can you drill the tooth? Like, they say, 3 minutes isn't long. Well, hold your breath for 3 minutes. Let's see how long it is. How about we go in the ring and box for 3 minutes and you hold your breath? Very long time. That's an eternity. It's all relative. So if you're the one in the chair getting drilled on, 3 minutes, it begs the question, what are you doing for 3 minutes? Do you not see the end before you start? Maybe you need more training, whatever it is. And I'm not rushing. A light brush stroke. I don't burn the pulp, just a very, very methodical. But interesting. Yeah, it's a strange time. The value system.
I think one of the things that every applicant, every young dentist that comes for a job has in the back of their mind, that if dentistry is not their career, if they have that, tapping away in the back of their brain, they think it's fine to quit dentistry and then go back to school and learn something else. And so they end up being 40, 45 before they actually start their next career. That was never an option for me. I left school. I actually didn't want to be a dentist. I actually wanted to be a doctor, but I didn't get the grade. And, I was going to go back and do my last year of school again. And my mother said the day before the closing date, she said, well, why did you put dentistry down as second choice if you didn't want to do it? All right, that makes sense. So I thought I'll study hard and see if I can get a transfer into medicine. And so I did. I studied hard in second year. I got 3 distinctions and 2 credits out of 5 subjects, and I got the transfer to medicine. And I thought, I've only got 3 more years of dentistry, and then I can be out earning money. All the guys I went to school with were all in trades. They weren't at university. And I thought, I just really want to just experience life. I don't want to be a perennial student. And I've met people like this. I met a chap who was a greenkeeper. And his wife said, greenkeeping wasn't his first choice. He went to TAFE to do something else, and that course was full or gone or didn't happen. And he said, okay, what have you got left? All right, I'll try greenkeeping. He topped the class in greenkeeping, but he hated it because every year he got a different board of directors. And so he said, it's a different employer every year. The board of directors at the golf club changed. But my point is, back in those days, Stephen, we just did what we had to do to get the result. And then, like you and like me and like others, we say, well, let's be as good as we can be. Let's be the best person we can be in this role, so that when people need to recommend a dentist, they'll recommend me because they've known, not because they've been my patient. Sometimes I got recommendations from people in the Chamber of Commerce and says, oh, everybody in the chamber who goes to the dentist, they go to David. And so it was just new people come to our chamber and they go, all right, where do I go to the dentist in this town? Oh, you got to go here. It's going to cost you a little bit more, but it's worth it. That's the best thing anyone can say about you. It's worth it. Doesn't matter that cost. And, you try and get your wife to change her hairdresser. Oh, we could go to a cheaper hair. No. The nail lady. No. The pool guy. No. It's all about the service. And compare. Oh, the guy over the road's got a cheaper lawn mowing guy. Yeah, but it doesn't look like mine. So it's about that service. Before we end, you threw me a carrot and you said something about the Goldman School of Graduate Dentistry would be a great story to end with. Have we got time? Can you tell me that story?
Yeah, it's not a long story. I love this story. This is a true story. When I went from New Jersey Dental School, which was 2 medical schools and a nursing school and a dental school, it was a massive, massive cafeteria. And there was always ample seats and it was huge. But when I went to the Goldman School at Boston University, it's said on the building, Henry Goldman School of Graduate Dentistry, because Dr. Goldman was the one who raised all the money to set up the university. So he never wanted his name on the building because he was a humble guy, and he was just doing something that he loved. And it turned out into be a great institution. The first day I'm there, the very first day, well, I'll back up. I made application and I didn't hear from the residency. And I got accepted everywhere but there. And I really wanted to go there as my first choice because I was told that's the best place for me. So I called and I spoke to the chairman of the department, Remo Sinibaldi, Dr. Sinibaldi. And I spoke to the secretary. I said, I didn't get accepted. Where's my acceptance? A little presumptuous. And she said, where are you? And I said, I'm in dental school. And she said, oh, we don't ever accept anyone right out of dental school. You have to go practice for a couple years. So I said, can I speak to the chairman? So she put him on and she was reluctant. And I said, Dr. Sinibaldi, I'm a dentist. I'm about to graduate in a few months. Would you say that I possess the skills of a dentist? Yes. I said, do you think that practice makes perfect? So he said, this is a setup question. I said, well, yeah, it's kind of a setup because perfect practice makes perfect. If I teach you to do something incorrectly, you'll get very proficient if you practice it incorrectly, right? So I said, why do I need to go practice for 2 years when I don't really have great skills? I'm just right out of dental school. Why don't you take me now and build me into great instead of letting me go 2 years to fall into some mediocrity in your mind? So he said to me, are you sure you don't want to go to law school? I didn't understand what he meant. I said, no, I want to come. I'm finishing dental school. He said, well, your argument is very compelling. So they accepted me. So the first day I'm there, I have a tray, with all the food, and I'm looking around, I don't know a single person, and there's no seats. And all of a sudden a hand goes up across the room and it got my attention. And it was one of my professors who I had recognized his picture, and he pointed to come over. So he's sitting at a four-top, and the table was right at the entrance of the cafeteria where there was a door into the cafeteria and out, down a long hallway. So I go to sit down and I put my tray down and I'm watching not to spill anything on my new professor, right? I'm nervous. I put the tray down. I go to sit down and I look up and Henry Goldman is sitting across the table from me, the man whose name is on the building. So I look up and I said, Dr. Goldman, oh my God, this is an honor. I go to shake his hand. He says, I'll only shake your hand if you call me Henry. So I'm super nervous. I said, yes, Dr. Goldman, yes. No, it's Henry. And he said, the first time I ever saw this was he pointed his finger at me and he said, I told you, and I don't want to point my finger at you. And he put his hand in front of his finger because 3 fingers are pointing back at him, he said. So I said, okay, Henry, thank you very much. And he called me Dr. Feit, and he got my name right the first time, which was very unusual. So I said, but Henry, you must call me Steve or Steven. So he said, okay, Steven. So with that, we hear the janitor wheeling the garbage can down the hallway, the noisy wheels that need oil. And Henry looks down the hallway and Henry says, hey, Charlie, put that thing away and take a load off. Come over and sit with us. And with that, the other person, who I don't know who it was, another professor in another department, got up and left, opening a seat for Charlie, the janitor with the garbage can. So next to me on my right is my professor. Henry Goldman is across from me and an empty seat. While Charlie was putting the garbage can in the closet, and I'm watching him, he's in the hallway, Henry gets up and he goes to get a soda for Charlie, and he waits online in his own school. He didn't cut the line to pay for the soda. He waited online, paid for the soda, insisted on paying, comes back, and it was grape soda. Grape. Not Coke, not Pepsi, not Sprite, grape soda. So the first thing I thought was, wow, Henry and Charlie have done this before. Henry knows, to your point, what Charlie likes. Henry puts the can down. Charlie finishes in the closet. Charlie comes and sits down. Henry says, Charlie, this is Dr. Feit. So I said, no, Charlie, it's Steve. So Charlie says, hey, Steve, nice to meet you. Charlie was he looked like he was 80 years old, bow-legged, sweet human being. And the four of us are talking. So lunch ends, we say goodbye, and I go up into the clinic. A couple hours later, I run into my professor who is sitting to the right of me. And he says to me, "What did you think of lunch?" I said, "Oh my God, if you release me today, I got more of an education than anybody in this university in 4 years." So he said, "Why do you say that?" I said, "Well, I learned how big a big man is how he treats his fellow man." That's what I learned, because Dr. Goldman is an amazing person and everybody is special and everybody is treated the same way, no matter what their station in life. And that's what it is. And he said, "Anything else?" And I said, "Yes." So I'm very honored that I met the most powerful person in the university. So he looked at me and he said, "Oh, yeah, Dr. Goldman doesn't come in every day." I said, "No, it's not Dr. Goldman. It's Charlie, because Charlie has the key to every single door in this building." So he looked at me, he's like, "How did you come up with that?" I said, "Well, Charlie's here every day. I know Dr. Goldman's not here much." But what a story on so many levels. When I taught in universities and the student doctor would have me call them doctor, I'm like, "Listen, you don't want to be a doctor. You want to be a human being. You want to be so when I present and my slide comes up, it says Stephen Feit, comma HB, and then everyone's talking, what is HB? Who has that degree? I said, it's human being. Be a human being. They don't sue Steve. When the patient calls you by your first name, they don't sue you because they like you and they give you an opportunity. If something doesn't go 100%, you can make it right. And just be honest, explain what happened and explain the solution that fix it. And so, the first question I always get in deposition is, "Doctor, how many times have you been sued?" They don't ask if I have been sued. They ask, "How many times have I been sued?" And then they'll ask a trap question, "What do you get paid for your testimony?" I said, no, I don't get paid anything for my testimony. My testimony is mine and mine alone. Ethics are non-negotiable. My integrity is non-negotiable. I get compensated for my time of preparation, my skills, my educational background, my knowledge base. That's what I get compensated for. And they'll take you down a rabbit hole. Yeah. So then your verbal skills get better when you're speaking to a patient. You don't disparage the previous dentist. You just say, "Hey, look, we have better techniques, better materials, better things that we can get over that won't happen again," and all that kind of stuff. And it goes on and on and on. But Henry Goldman, what a special guy. What a human being, a grand human being.
What a special day, your first day, and to be greeted by him in that manner and treated by him in that manner. Yeah, because I can just imagine how fearful or frightened you were in that cafeteria. Where do I sit? There's nowhere to sit. And then your professor saw you and calls you over, and there's Henry Goldman, and you knew him, and you greeted him, and for him to say, "Yeah, call me." And it reminded me in my practice, I always used to tell my patients, they started calling me doctor. I said, "No, call me David. That's just call me David. That's my name." And so then I got to call them by their first name as well. And that was, again, the relationship. You want them to like you so much that if something goes wrong, they would like you to make it better rather than despise you to make you pay for something. And there's so many lessons in that story that you've told, Stephen. It's been great chatting with you. We've run over time, so I'm hoping there's lots of ums and ahs and pauses because I can edit those out and get it down. But Dr. Stephen Feit, Steve, thanks very much for being a guest on the Ultimate Dental Podcast. Please, for our listeners and our viewers, what's the best way for them to get in touch with you if they'd like to have you come to their practice, or they'd just like to hear your story again? How can they reach you?
Oh, thank you, David. First of all, it's been an absolute pleasure and honor to be with you, as you know. Anyone can call my personal cell phone number. It's US. It's area code 561-350-0335. Again, it's 561-350-0335. My personal email is quad team. That's Q like Queen, UAD like David, quad team, TEA at Proton, PROTON.E. E is Mary Echo. So Quad Team, I got 4 kids. That's my team. We're a team. Quad Team at proton.me.
Stephen, it's been great talking with you. Like you said, throughout our time together, there's plenty more to talk about, and I'm sure I'm going to be contacting you again to visit those stories, because you're a great storyteller. You're easy to listen to, and I'm really thinking that you're going to be having dentists call you to say, hey, can I chew some fat with you, and just, toss some ideas around with you. So again, thank you very much for being a guest today on the Ultimate Dental Podcast. I really appreciate it.
Thank you so much.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.